to Health Matters. I'm Shweta Ranjan, and as you all know, the current coronavirus outbreak is very scary and concerning for many people. We understand how stressful this time could be for people with cancer and their families and caregivers. In this regard, we bring to you the direct interactions with famous doctors. And today on the show, we have with us Dr. Chandragouda Dadagoudar, Director and Head of the Department, Medical Oncology, Aakash Healthcare Super Speciality Hospital. Welcoming Dr. Gaur to the show. Hi, Doctor. How are you? Welcome to the show.
Thank you very much. I'm fine. So, big namaste to all of you.
Yes, Doctor. So, Doctor, how is the situation? You are in the field every day. You are meeting people. How stressful it is, how much concern should people be about this? I would like to know your take on this first.
When it started, maybe in the early 2020, we were very worried, and everybody was taking a lot of precautions, like mask and all the distant maintenance and all that was fantastic. So as we went down, so now in the recent past, that has gone. I think the fear has gone. But ideally, I just want to reiterate the fact that still that guidelines hold good. You need to maintain the distance. You need to wear the mask. That is definitely there. The reason why the lot of cases have gone up in the recent past is because of all this, because of the laxity of laxity on our part. So it's not just the government which has to do everything. It is we as a citizens, responsible citizens, should know our responsibilities as well. So because of that laxity, it has gone up. It is definitely very scary. In our hospital, I can say, so to accommodate, we have put a tent for a COVID patient. So it's so scary.
Yes, doctor. So one side, the disease, COVID-19, is very scary, very deadly. And on top of that, if there is a comorbid situation, it becomes scarier. It becomes deadlier. So what are the precautions usually that a person undergoing a cancer treatment, since you're dealing with this medical oncology, what are the concerns of people undergoing oncology treatment, and what are the precautions that they need to take?
So, other than the usual precautions, we need to prioritize the patient. If a patient who is having cancer along with the COVID, or a patient may not have a COVID, in this era, anybody having a cancer, if he needs a treatment on priority, it's called as tier 1. So they have to be started on treatment. So if some for example, the chemotherapy causes a lot of myelosuppression, in the sense that causes a decrease in the counts, and that might enhance the COVID infection. So then we usually do a COVID first and make sure that the patient has a COVID negative, and then start with the chemotherapy. And somebody who is on a palliative chemotherapy, in which we are giving a chemotherapy just to palliate the symptoms, there we can wait. So we can wait for the COVID phase to be over, or get the COVID test every time they come, and then treat the disease. So that's the way we take it. On the other hand, a lot of patients who have a curable malignancy are not coming to oncologists for the fear of COVID. So that is a downside of a COVID era, as far as the cancer patients are concerned.
Right. So what are the special precautions being taken by the hospitals, since they are very prone to it? Once you develop cancer, you're undergoing, or even if you have symptoms, they're scared to visit a hospital.
So a lot of us are resorting to a teleconsultation. So somebody who is on a follow-up on an oral medications, so we do a teleconsultations, and video teleconsultation has sorted out a lot of these issues. One. And if that is regarding the OPD patients, or some patients who require active treatment and newly diagnosed, we make sure that patient may be managed by oral treatment. So we manage them oral treatment, and then probably call less frequently to the hospital. So that avoids the frequent hospital visits. Somebody who requires treatment.
Yes, doctor. Yes.
So there we have to make sure that COVID is negative. They are put in a COVID negative ward and will be discharged as early as possible. So the hospital visits will be again will be less frequent in them as well.
So, but in cases like cancer, do you think online consultancy would work?
only if a patient is on oral treatment. Oral treatment is absolutely fine. But in a patient who has an active disease, very symptomatic, their online will not work. So we need to assess it. If a patient requires that, it needs to be admitted. We tell them on teleconsultation that please, you have to come to emergency. Yeah, I have to see you. So usually around 80 to 90% of the patients who are on oral medications, the teleconsultation will do.
Right. So, do you think, doctor, since you're dealing with the patients every day, do you think even if people are having the symptoms of cancer, they are delaying their treatment deliberately since the disease has gone so long? COVID-19 is there for almost, I don't know, 7, 8 months. So,
Yeah.
do you think they are deliberately delaying, even if they have symptoms, they are delaying the test, they are delaying the treatment?
I have examples in my own patients actually. So somebody who had a normal breast cancer and she was a non-follow, normal in the sense the normal follow-up of a metastatic CA breast. So did not come for last 9 months. Now we have a very bad disease at current scenario. So definitely that fear is there. As the same thing was pointing out, even the new cases are not coming because of the fear of COVID. So also the old patients are delaying the follow-up because of this. So teleconsult is in that regard will be the ideal one.
हमसे जुड़े रहने के लिए सब्सक्राइब करें यूट्यूब पर, फॉलो करें ट्विटर और इंस्टाग्राम पर, लाइक करें फेसबुक पर और ज़्यादा जानकारी के लिए नेशनल खबर की वेबसाइट पर जाएं। आपको टाइप करना होगा सिर्फ नेशनल खबर।